Dr. Greg Burzynski. I'm an internal medicine doctor, and today we'll be talking about hormones and hormone imbalance. This is a very expansive topic, so we're just going to be covering some of the details of this. This is something that's dear to my heart now as I'm aging, and this is me and my wife, hopefully when we're 90 years old, enjoying a nice time in Italy and maybe being on optimal hormone support and the other things that come then. There's been a lot of confusion about what hormones are and the Women's Health Initiative that really set us back as far as hormones and even scared doctors like me because at the end of the day, there was some inappropriate extrapolation of the study and meaning that we are going to increase women's and even other people's risk of cancers, especially. That is not exactly the case. So we're here to talk about the benefits of these things. So hormones are essentially chemical messengers and they travel to other parts of our body. They are going to lock in key fashion. They do many, many processes. They're essential for growth and development, metabolism, sexual function, and reproduction and mood. So the question is, do we lose our hormones or do we age because we lose our hormones? That's kind of a chicken and egg question, right? I personally think as we age, we're losing our hormones. And ideally, we should find out what is the way that we can get our software booted so we can produce the hormones that we had when we were at optimal age, like 20 years old or so. But until now, we have the option of supplementing our hormones safely at that age when we were younger. So what are hormone imbalance indicators? Well, you have insomnia, bloating, weight gain, low sex drive, constipation, fatigue, numbness and tingling in your hands. I love Suzanne Summers' explanation of this in her own way, which is the 7 dwarfs of menopause, which is itchy, bitchy, sleepy, sweaty, bloated, forgetful, and all dried up. So if anybody's suffering from those things, this could be a good solution for you. Does this sound familiar? It's 3 or 4 o'clock in the afternoon. We're hitting a wall. We're not the happiest person that our partner thought we were. We're irritable. We're waking up in the morning. We're sweating. We're gaining weight. Even though we're exercising a lot, we're having all these joint pains and we're running to the bathroom and our libido is gone. If that's you, then we should probably get a workup. For women, especially, estrogen is super important. It's present both in men and women, and it has numerous functions in the body. It's not just to make one Aphrodite. It can, of course, control hot flashes when women are entering that change, makes bones strong, helps the memory, helps the skin be nice and plush, and of course makes us happy as it can modulate and increase those happy neurotransmitters, serotonin and dopamine. So don't think about it as just a Prozac deficiency. Think about it as a hormone imbalance. That's why maybe we're not as happy as we should be and having depression, anxiety syndromes. So in this country, at the age of 51, that's when women enter menopause. Unfortunately, a lot of women enter early. About 1.3 million women enter early, and 15 years even before that age, women could have symptoms. And this is something where we don't just get over it. This is something where people, if you haven't seen them in a while, can literally age years in the span of months. I'm fascinated in aging and also the longevity principles. We know that when women hit menopause, they hit accelerated aging, as opposed to men going more down a smooth, hopefully glacial pace. Now, most importantly, we don't want people to have heart attacks. We don't want them to die because of things that can hopefully be preventable. And I think in today's world, 1 in 3 women are unfortunately having cardiovascular disease, heart disease, as a cause of death in menopause, that 1 in 7 in premenopausal status. So we need to get balanced. And of course, this is maybe oversimplistic, but we have to also work on our just lifestyle. If we're not sleeping and we're not eating right, then of course hormones need to also be looked at and fixed. So hormones, women, and the heart. We know that supplementation with pellets has been shown to have a positive effect on the body fat in postmenopausal women. The lipids improved, the HDL, LDL, there was less fat seen, and even the heart benefited from a touch of testosterone. We can't forget about the testosterone as well. That is something that women have as well, not just men. So the scary thing about hormones, as mentioned, is the breast cancer concern and other likewise illnesses which people have been afraid of. So let's just dispel some of these myths, right? So definitely, if somebody has a hormone sensitive breast cancer, they should not be on hormones. That is unfortunately usually the case. If they have active disease, they should not be on hormones. But if a woman is ruled out and does the usual screenings and they have no breast cancer in the body and it makes sense for them, then they can be on hormones. So this is not causing cancer if one doesn't have cancer. Now, we also have to think of testosterone as well. That is not causing cancer as well in men. Of course, if you have some of the cancer there, it will probably react to it. So we have to understand that we've had these hormones at a healthy level when we were younger, and we didn't see everybody getting cancer when we were young. So this is something that we have to sort of revisit and reassure people. The right people can be on hormones if done well. And a way that we do this is with these pellets that have some benefits, I feel, as compared to other things. So if somebody is entering the menopause time, right, we have hot flashes, we have our skin going, we're getting depressed. This is a perfect time to have hormone replacement therapy. And I think most doctors are on board right now, as opposed to years ago. We have memory benefits and so many other things, but we always have to think about the Goldilocks zone of being on these hormones, because oftentimes we see bad things happening when people do things inappropriately. And I think what we always think about hormones is the anabolic, the synthetic hormones, which are the ones that can really damage people. And then they really need to get on the right hormone regimen. So men, let's not forget about the men. We've been talking about mostly women. Testosterone is really beneficial for bone health, brain health, breast, heart, and also relationship health. Mental health is essential. So if we fix the women's hormones, let's not forget about the men, because sometimes the women are asking, what's going on with you? You're not where I want to be. So men and women both have testosterone. Men, of course, have large amounts of testosterone than women. As we hit 30, we go through this andropause. We lose a little bit every year. Women, unfortunately, lose much more later. So if you look at estrogen and testosterone in women, that ratio is actually greater of testosterone, interestingly enough, to the amounts of estrogen at times. So you have to take things in perspective that we have these hormones in our bodies, and we should replenish them if we're going into this time of our life, and to do it safely. So then, how can we do this? Well, it's all about the levels. So we can fix our lipids with better hormone balance. We can lose some weight, which, as we know, obesity is a big problem in our society. Muscle loss, sarcopenia. Sarcopenia is one of the things that we are seeing as a decreasing contributor to our longevity and health span. If we can't pick up a heavy suitcase and put it in the over compartment of our airplane, then that's not a good thing. If we can't get off the ground without assistance, we're probably not going to be as strong as we should be and live as well as we should be. Exercise capacity is improved. So these are all pluses if we get ourselves into a healthier level of testosterone. Now, of course, the heart lipids. What happens with hormones in the heart? We have better numbers when we are appropriately managed. So better LDL, your HDL, and of course your fat content. Body composition, I'm a huge fan of. We don't just want to look at the body mass index. We want to see how people are looking as far as their scans or DEXA scans are. And this is something that, if you're doing the right things, can definitely shed some of that fat and have improved lean body mass. So natural testosterone is a good thing. So women need testosterone because, again, it's going to help both men and women feel better, have stronger bones, get that brain firing like it was. The heart's going to be thanking you. And as well, I think relationships are improved. There have been so many times when I've seen and heard patients saying thank you because we've had literally marriages on the rocks. And you do something like this, you fix that component, and life goes on, and we're back on where we should be. I always think of how many divorces or uh, things like that could be prevented if people were properly managed with their hormones and just general health. So let's talk about the preferred way that we like to treat here. It's with a pellet, and the preferred pellet we like to use is a uh, Avexapel pellet. Now, probably this is the newest way because it has a touch bit of steroid in there, granulated, so you don't have scarring, and there's very little downtime. It's the individual dose of the hormone, which is given under the skin in a fairly atraumatic procedure. So that is something nice that we can do in the office for the patient. And literally in the next few days, they can be feeling much better. They can go back to playing their usual sports. So as mentioned, we have synthetic versus bioidentical. We prefer the bioidentical hormones because these are the ones that are most similar to our body, and as well, the ones that are in the pellets. And that can probably get you to your destination better. We, of course, have other options such as pills and patches, but the pellets we feel are a good way to provide constant dosing, and as well getting a steady stream for that individual that's personalized. And of course, we communicate with the patient. What are your desires? What is your symptom here, right? We don't just look at the numbers. We want to talk to the patient and see what symptoms are you having. And we can always start lower than we need to. We can titrate and then get you on that proper dosage of the hormone so that you can be living your best life. As we can see, we have a green line here. This is the implant. So you have a steady state of hormone being released. It's a brilliant way to have that being in the body the whole time. You don't need to dose it daily. If people have ever been on these hormones, such as creams, every day they have to apply and lather a cream onto their back, their skin. They then hug somebody. They want to make sure there's no transfer. And sometimes I've seen patients that have been super compliant with these creams and it just doesn't even register. They don't feel much better. And I do a blood test and it's not even getting into their body. So pellets, we feel for the person that is the right fit is the way to go. Of course, you can do patches, but again, there's some problems with absorption, but there's a lot of happy people with patches taking the hormones. So this is an open communication. We don't just have one strategy. We have many, but that's when we determine in the consultation who's the right fit for what modality. And of course, if you're wanting to do supplements, then we can of course do that. We don't have to jump to pellets. We want to look at your lifestyle. We want to make sure your sleep has been great and everything is in line, in sync. We don't want to be overly simplistic here. Testosterone has been brilliant as far as strengthening bones. It is something that we want to keep strong as we age, because if we have a fall and we're older, we could have, unfortunately, an injury that ends us if we fracture a hip and things just go downhill. It's demonstrated a fold increase in bone density over oral estrogens and 2.5 times greater than patches. So this is a good thing for men and women to realize that we need that testosterone to support us in our as we age for that great bone health and muscle health. Well, as we get older, we certainly do feel our bones, and I do. 10% of men, 18% of women greater than 60 have, unfortunately, osteoarthritis. That's the arthritis of wear and tear. You're a football player when you're young, and now you may be paying for it. We can find some benefit actually with proper hormone balance, as estrogen and testosterone can stimulate precartilage cells, possibly reversing some of that development. We, of course, incorporate other things, but that could be another benefit of having proper hormone balance. Now, unfortunately, as we age, Alzheimer's disease is also something that strikes us men. Women, unfortunately, have 8-to-1 ratio that's greater for this disease. But if we properly balance estrogen, we are able to as well hopefully have better odds for success. And men with testosterone deficiencies as they age likewise are having worse cognitive findings. So there's many pluses to getting your hormones balanced with the right strategies. But I welcome folks as well to listen to Susan if she is willing. She is a excellent nurse practitioner. She's been doing pellets herself, and her life has changed for the better. And she is actually the main person at HCM Skin who is actually doing the consultations and the pellets. So if she has anything to add, I welcome her.
Yes. Okay. So first I am doing, I'm 53. So I've hit that wall and I started having the hot flashes. And since I've had some testosterone with estrogen and progesterone, I feel like I'm 30 again, late end of 30. The benefit of hormones is exactly what Dr. Gregory Burzynski said. The hormones are constant communicators of our systems, and when they're at their when you're young and they're at their peak, you are having your family, you're raising your family, and as those hormones start to decline, you stop your you're raising your children now, and so having those hormones just keeps you at your optimum level. Women who have normal hormones don't have heart disease. We know that about estrogen. But then when that estrogen leaves the body, we know that heart disease becomes more of an issue for women. So hormones in general are great. There's a lot of options. I do agree with Dr. Gregory Burzynski that the pellets are the best way. It keeps the levels steady, and not having to do monthly shots or daily applications. So
Susan, how often, I'm getting questions, how often does Dr. Burzynski give you the pellets?
every 3 to 4 months.
Okay. And Dr. Burzynski, do you test the blood lab work every time, every 3 to 4 months? How does that work?
Can I explain that?
Oh, well, we always do a baseline once a year. And then we'll do follow-up to see where you are at the beginning. And then after the pellets are inserted to see where you are about 4 weeks afterwards. And then can see how your symptoms are and what your lab values are and trying to see the correlation.
Okay. And a question here, does pellets help with your sleep?
They can.
Okay.
They can. But there's other life issues that can hinder sleep.
Does this require an initial consult to come in first?
Yes.
Okay.
We do want to come in, see how see what your complaints are, get your information, get your labs drawn, and then we can set up a time afterwards to actually do the injection.
Is there anything else you would like to add, or Susan?
No, I think it's a great option for people that have some of these symptoms, and we would love to help people live their best life.
Absolutely.